Hi everyone, welcome to the CEIH Statewide Clinical Network Conversation Series. My name's Kate Turpin and I'm the Acting Networks Program Director at the CEIH, and that's the Commission on Excellence in Innovation and Health. And I'd like to say thank you all for joining us for today's session. Before we start, I'm going to start off with acknowledgement of country. We would like to acknowledge this land that we meet on today is the traditional lands for the Kaurna people and respect their spiritual relationships with their country. We also acknowledge the Kaurna people as the custodians of the Adelaide region and that their cultural and heritage beliefs are still as important to the living Kaurna people today. And for those of you who are all online, we acknowledge the lands of your respected Aboriginal people. I'm going to provide a brief background around the CEIH and the statewide clinical networks before I hand over to today's presenter, who is Ruth Holmes, who leads the Urgent Care Network. For those who are unfamiliar with the Commission on Excellence in Innovation and Health, we are the lead agency for innovation and healthcare for South Australia, and our vision is together, let's create better healthcare for all of South Australians. To deliver this, we bring consumers, clinicians and other collaborators together to work towards our vision. So to work towards this vision, we need to support the creation of new ideas for better healthcare. We do this through a range of portfolio areas, including partnerships, clinical networks, who are representing today, our patient reported measures team, clinical informatics, innovation, and as I said, clinical networks, which are here for today. So the CEIH Statewide Clinical Networks are a group of health professionals, health service organisations, consumers, carers, support workers who collaborate to achieve high quality care in a particular clinical area. So for today's presentation, that area is urgent care. They operate across the continuum of care, including private and public, community organisations, and our local health networks. The statewide clinical networks identify and collaborate to resolve strategic problems that will lead to significant improvements for healthcare for all South Australians. Each network has a clinical and/or consumer lead and a steering committee to develop the vision, the goals, and the working program for each of those networks. We currently have 8 clinical networks, being surgical and perioperative care, chronic pain, clinical genomics, adolescent transition care, cardiac care, urgent care, cancer, and palliative care. At the moment, we're running a series of clinical conversation series, all focusing on each of our individual networks, and today's is urgent care. These have been running from October through to December, and if you have seen our previous ones or would like to go back and see our previous ones, they'll actually be on our website, and you can go on to the various networks to upload their specific videos. What we're encouraging is a space to provide the network leads to explore their networks and for you to hear more about the work that they've been doing and to ask any questions you may have. And that's a list of what we've had beforehand. So just some housekeeping rules before we kickstart and I hand over to Ruth. The presentation we recorded, however, after the presentation has been completed, we will switch off the recording to enable you guys to answer any questions. We remind you to please put your mics on mute. And when you are doing the questions and answers at the end, can you please take it off mute? And could you please, if possible, put your camera on, because it's always good when you can see your face smiling at you to answer that question and know who you're talking to. I'm going to hand over the presentation to Ruth Holmes, who is the clinical lead for the Urgent Care Network, and she'll continue on to let her know what her group's been doing. At the end of the presentation, we'll be actually having a poll to collect some feedback. To enable to do that, and I'll remind you at the end of the presentation as well, but to do that, you need to stay online to complete the poll. Once you actually do log off, you are unable to go back and provide your feedback. So Ruth, I'm going to hand over to you. I'm going to stop sharing my screen and welcome. Thank you, Ruth.
Thank you so much, Kate. I am just going to share my screen now. Just bear with me.
That's perfect, Ruth.
Brilliant. I'm just going to get it up onto this view. Okay, thank you. Again, I'd just like to join with Kate in thanking you all for being here. I'm really grateful for your interest. Before I start, this is always teamwork. So I'd just like to thank the other people here that are involved with the Urgent Care Network. So that's Marlou DeBouge, who's our network advisor, and Joanna Vlachos, who's our support officer and assistant project officer, and Emma Tolson. So just a bit of background in terms of the Urgent Care Clinical Network. It was set up in 2019, in July of 2019, just to essentially improve the urgent care access for over 75s, those with minor injuries, and for mental health emergencies, and looking at the rural metro transfer of patients. And those were its aims originally. Quite a lot happened over those couple of years, certainly in terms of evolution within the urgent care space. There was PCCs, SA virtual care service, and KVUCs emerged. There was mental health urgent care centres. And we also had the global pandemic of COVID. So there was lots of change and lots of challenges. But I think what the pandemic did was show how change was possible in a quick way and how systems could respond to challenges. And I think that was a really valuable lesson. And I think that's something that we need to still keep in mind as we think towards the future too. So I became involved with the Commission in July of 2022, really with two roles, that of leading the statewide urgent care clinical network, but also being involved with the collaboration with the South Australian Virtual Care Service. And the Commission had been involved with the Virtual Care Service really since at its inception. There was lots happening when I started, and I think everyone would be aware of the federally promised urgent care centres, were election promise and really based around reducing demand on the emergency departments. We have primary care, which is certainly under pressure with increasing rates to CGPs. We have talk of ramping and delays in accessing timely care. And certainly patients that struggle to access timely care end up presenting later and being sicker, and this puts increased strain on our emergent services. So I guess it's really important to think about what urgent care is, and the endorsed definition by the network was that of urgent, unplanned, non-life-threatening care. And they were really committed to supporting that and making sure that it was consumer-centred and achieved by collaboration with the relevant healthcare professionals, resulting in clinically appropriate care at the right place within the appropriate time frame. Not only this, but enabling linking of the consumer to the appropriate follow-up services as necessary. So this is by no means an exhaustive representation, but these are some of the services that exist in our urgent care landscape. And we all know that patients with urgent care needs can be found across our health system. So they can be in emergency departments, but also they can be in pharmacies. And so I think we really need to stop thinking about consumers as a specific service consumer, such as an emergency consumer. We need to think about them as people with needs and think about where that need is best met. So there are multiple services which can be accessed in a variety of ways. And those, as you can see, include PCCs, virtual care services, general practitioners and health direct. Also include SAS and emergency departments. And outlined in red is Urgent Care Centre, so the new initiative. Now, they were an election promise and will be joining the urgent care landscape. They certainly exist already in various ways, nationally and internationally. And there are different models of what they look like. And in some places, they act as a front door to the emergency department. Really, most people have urgent care needs, not emergent care needs. And so urgent care centres are often GP-led. But how do they fit in, and how do we sustainably staff these new initiatives with finite pools of resourcing, including clinicians? So just looking at the landscape, you can see there's numerous stakeholders involved in the urgent care service delivery. And so one of my roles as a lead was to gather a group of people around me within the steering group who represent this, so we can think radically about whole system change. So in the steering group, we have nurses, nurse practitioners, a variety of medical practitioners, including GPs and rural generalists. We have emergency medicine specialists and indeed geriatricians. We have people involved in community care. We have the South Australian Ambulance Service and MedStar. We have the South Australian Virtual Care Service. And really importantly, we have consumer representation. And that's something that we really value here at the Commission and is seen throughout our networks. I'm really, really fortunate to have Lynn. I think she might be listening. And it's really helpful to have lived experience that can be shared as we think about how we can rise to the challenges that we see in the urgent care system currently. Sorry. There we go. So we're talking about our steering group. I'd actually like you to meet one of the members of our steering group. And so I'm just going to turn the camera around. I can't see our little thumbnail, so I'm kind of That's see.
Perfect, Ruth.
Thank you, Kate. So I know who you are, but would you like to introduce yourself?
Yeah. For those that don't know me, my name is Jason Walters. For those that do know me, my name is still Jason Walters. I'm a rural generalist nurse practitioner working in rural South Australia and working metropolitanly in Lime Emergency Department.
Wow. So you work across a range of different spaces.
I do.
Yeah, that's really interesting. You said you're a rural generalist. What does being a rural generalist practitioner?
Okay, so being a rural generalist nurse practitioner means that I don't get the luxury of saying, oh, I'm sorry, I can't see you, you're not in my scope of practice. It means that I will see and assess every patient that presents in that rural setting, and indeed, to some extent, longitudinally. So if you present, I will review you, look at you, work out what I can deal with, work out what I can't deal with, work out who can deal with it, and how to get you there.
Wow, so you've got really quite a broad scope of practice then, Jason, haven't you?
Yeah, very, very broad scope.
Yeah, so I guess with that broad scope of practice, there's a lot of skills that are involved.
You would think so. You would think so.
So I guess, how did you become
a rural generalist?
Yeah, what does that look like?
I've been doing it for the last 8 years. So it was, or being a rural generalist for 8 years. I started off in a little town called Karoonda, working for Medical Associates. They had a workforce problem, surprise, surprise. I wanted to move into the generalist field. So they supported me through education, support, training, not to replace a registrar, but that sort of level as GP registrar, starting off over the year or so, being supervised and being led and being taught to, over probably a period of 18 months, choose becoming an independent autonomous practitioner. Also keeping up education through Learning and with the Rural Emergency Skills Program, emergency medicine education training evenings, and putting together a curriculum for nurse practitioners to try and follow what I've done.
Wow, that's exciting. So I guess then with the syllabus that you put together, it's something that other people, if they were interested, could think about.
Certainly, I mean, looking at workforce and workforce pressures, nurse practitioners we're not here to take over the world. I want to point that out straight away. But we're here to work in partnerships and in collaboration with our other healthcare clinicians to provide that urgent care. As we all know, there is a need for urgent care as well as emergent care. So I think having some governance behind how that looks. When I started, the governance was more or less up to myself to develop in conjunction with Medical, which I think we've done a reasonable job of putting some decent governance underneath, which hopefully can transfer to develop further clinicians in that workforce, working in that collaborative space.
What do you enjoy about your job? What makes you want to keep doing it?
I think it's the seeing people in their own environments, in their own towns, and being able to provide a service and an assessment and treatment that can be done in their local hometowns or rural centres, so they don't have to travel. But also, I'm the sole provider in Morgan. I have a clinic in Morgan, which I go once a fortnight to once a week, and being able to work out which patients need to be referred to outpatients from Royal Adelaide or can wait, or those that need that urgent care, which I can deal with, or alternatively those that I need to up that urgent care to one of my general practitioner colleagues. So it's a whole range, but looking at the whole picture and being able to, when someone's son runs in and gives you a big hug and says, "Thank you for saving my daddy's life," and you're part of that little local community, that's why I love it. That's what I love about it.
Yeah, absolutely. So that being able to treat patients, meet the need where they are, not necessarily have to uproot them and move them. So this route is available to others, essentially.
It is now. And we've got a trial. We've got a few nurse practitioners which are doing the course at the moment. We envisage it to be a supported course in a general practice, supported by GPs and myself and other specialist clinicians as required. But we started that in October this year. I believe we've got our first guinea pigs, if you like, and we've got 3 or 4 of them out there at the moment learning and going through those steps. So we're hoping to expand that into next year and build something worthwhile to support that workforce, as I said, with governance behind it.
So important. And it's, I guess, really about having the people with the right skills in the right place. Not necessarily be restricted by title role necessarily.
I think we're all clinicians, and we're all clinicians looking at how we can best look after our patients or the people in our community. And I remember a GP said to me once, I guess what you do is you work out what you can do, then you escalate the care, like I work out what I can do and escalate the care to a specialist. I said, exactly. It's that same sort of model. We need to assess and then work out. I think the important thing is to know what you've done.
Absolutely. Well, thank you, Jason. I think it's really helpful to understand some of the different roles that are out there. And and I guess if people are interested, then certainly contacting the Commission
would be a good start.
Okay, thank you very much.
My pleasure.
Just right. Can you all see me again? Okay. I'll just continue on. So that's Jason, and he's one of our members of our steering group, which is great. So I mentioned earlier about the partnership that exists between the Commission and the Virtual Care Service. As I said, really from the inception of the Virtual Care Service, the South Australian Virtual Care Service, who is one today, by the way, can I just add, set up a year ago to assist in achieving better access to the most appropriate healthcare, is essentially a virtual emergency department. I've been involved in a pilot that looks at the direct admissions of patients to general medical ward at the Queen Elizabeth for patients essentially requiring a gen med admission. They get seen by a senior clinician within the virtual care service, and we can request investigations and treatments virtually, and the patient goes direct to their bed. It's a lean approach, it breaks down barriers, and it's shown to be safe and patient and family centred. So this is one of the patients that obviously details have been changed somewhat, but I think it really demonstrates how effective it can be when the system works together. So that being SAS, the Virtual Care Service, and the Queen Elizabeth Hospital. So this gentleman was about 75 and he had a background of anxiety and Alzheimer's, and he'd been short of breath. He'd been essentially diagnosed with some airways disease by the GP, but had become increasingly short of breath and phoned for an ambulance, and that was about 1 o'clock. The ambulance arrived on scene, and by 1:25 they had called the Virtual Care Service, who reviewed this gentleman and then had had a discussion with the general medical team, who were obviously aware of this admissions pathway, and he had his investigations requested and his such as his chest x-ray and bloods and the initiation of treatment. And he then was taken by SAS directly to the ward where he was handed over. So from SAS arriving at his home to arrival on the ward was about 100 minutes. I think this is just a great example of a system working well. And this would be something that would be fabulous to be able to implement in a statewide manner. So, urgent care for South Australia. I really hope that you're getting the theme here, that it's about the person big at the centre and not necessarily the service. So, keeping everything patient focused. And there is lots of change. There is lots of new developments here. And I really hope that those developments, such as urgent care centres, can actually facilitate equitable access to care. We have the privilege of being able to assess people virtually now. And instead of having to move people from their homes, which may well be in rural remote situations, we can utilise virtual assessment. But what's really crucial in all of this is that we think broad system, and we think collaboratively, and we think about having the right skills in the right environment. So yes, there are challenges for the future, but with challenges also come opportunities to innovate and change. And my hope is that we work together to develop an urgent care system within the state that meets patients' need. And if you want to stay connected, these are the emails. Please do email us or visit the website outlined below, and we will do our best to help with your questions or inquiries or point you in the right direction. Thanks, everybody.